Have you ever stopped to think that your feet might actually be trying to tell you something? Something important about your health? Today, we're going to dive into a pretty surprising connection, the one between your feet and one of the hardest working organs in your body, your liver.
So let's just jump right in. I know, it sounds a little out there, right? But the source for this explainer, a video from Dr. Eric Berg, suggests that how our feet look and feel can give us some really valuable clues about what's actually going on with our liver.
Okay, but wait. Before we go even one step further, we have to be crystal clear about this. This is a huge disclaimer. What we're talking about here are potential clues, okay? They are not, and I repeat, not a diagnosis. So if you recognize any of these things we're about to cover, your first move, your only move, should be to talk to your doctor. They're the ones who can give you real tests and real advice.
So you're probably wondering, all right, but why the feet? I mean, of all the parts of your body, what makes them such good messengers for something happening way up in your liver?
Well, it actually boils down to some pretty basic physics, really. Think about it. Your heart is the pump, and your feet are at the absolute end of the line. It has to work super hard to get blood all the way down there, and then fight gravity to pull it all the way back up. So when there's a problem with the whole system, like a liver issue that's messing with your circulation, where do you think the first signs of trouble are going to show up? Yep, right at the furthest point from the pump, your feet.
All right, this is the part we've all been waiting for. Let's start decoding these warning signs. We're going to walk through exactly what to look for and what it might be trying to tell you.
First up, we've got two visual things to look out for. On one hand, you have these little red or brown dots on your lower legs. That's a classic sign of poor circulation, which can definitely be a red flag for liver problems. Then, on the other hand, you have spider veins. Now this is interesting. When your liver's having a tough time, it can't do one of its many jobs very well, managing your hormones. This can lead to too much estrogen floating around, and all that extra estrogen can actually weaken the walls of your tiny blood vessels, causing those little web-like veins to pop up.
Okay, who here has had cracked heels? Probably all of us, right? And you probably just think, oh, I need more lotion. But what if it's a sign of something deeper? See, your liver makes bile, and you need that bile to absorb crucial nutrients, especially things like vitamin B3 and omega-3s. So if your liver isn't working right, you can't absorb those nutrients. And one of the ways that shows up, you guessed it, dry, cracked, damaged skin on your heels.
All right, so we've talked about what you can see, but what about what you can feel? Well, itchy feet, especially on the bottom, can be a really weird clue. When your liver gets all congested, stuff can back up into your bloodstream and get deposited in your skin, which causes that crazy itching. You might also feel pain that you think is something like plantar fasciitis, or even just have feet that always feel hot. All of these could be your body's way of saying the liver is under some serious stress.
Okay, this next one, it might be a little surprising, but it's important. We're talking about bad odor. Your liver is basically your body's main filter. When that filter gets clogged and can't get rid of all the junk, those toxins have to find another way out. And one of those escape routes is through the skin on your feet. It's a sign that the whole detoxification system is just backed up. And here are three more big ones to keep on your radar. First is something called pitting edema. That's when you press your finger into your shin and the little dent just stays there. It's a telltale sign of fluid backup. Second, and this one might surprise you, is toenail fungus. A struggling liver can throw your whole gut out of whack, which can let fungus and yeast take over, and they often show up on your toenails. And third, white nail beds. This one brings us right back to that key theme, poor circulation. Okay, so we've seen all these potential red flags our feet might be waving at us. This, of course, leads to the really big question. What's putting our livers under so much stress to begin with? Let's dig into the common culprits, the things that can really overload and damage this powerhouse organ.
And honestly, this list probably won't be a huge shock. A lot of these are the usual suspects when it comes to modern health issues. You've got side effects from medications, for sure. But then there's diet. Tons of sugar, especially high fructose corn syrup, and not enough raw veggies. Of course, we all know about alcohol, but even too much protein can be hard on the liver because of all the waste it has to process.
And this quote from the source really just hits the nail on the head. If your diet is mostly processed, cooked, pasteurized stuff from cans and boxes, and you're not getting any raw foods, well, over time, that's just a recipe for putting a massive, massive strain in your liver.
All right, so we know what hurts the liver. Now for the good part.
what can we do to help it? Let's talk about a strategy for giving your liver some much-needed support.
So the big recommendation from the source we're looking at today is actually a two-pronged attack, a healthy ketogenic diet combined with intermittent fasting. And the thinking behind this is pretty straightforward. By cutting way down on sugar and processed carbs, you're giving the liver less fat to deal with. And intermittent fasting? That just gives your whole system, including the liver, a break, a chance to rest, repair, and regenerate. It's all about reducing the workload.
So at the end of the day, what's the real takeaway here? It's simple, really. Your body is always talking to you. These signals in your feet are just one of the ways it communicates. And the most powerful thing you can do, the very first step, is just to start paying attention, to listen.
And that really just leaves us with one final thing to think about. I mean, if your feet can tell you all of this about your liver, what other messages is your body trying to send you every single day? Makes you think, doesn't it?